Hello everyone. As we all know, transfusion has become an important way to treat some diseases in clinic. But if it is not properly, it will cause severe damage to patients and even death. So how should we select the donor's blood group in clinical transfusion? With this question, let's study the content of this section. Blood volume and principles of transfusion. Blood volume refers to the total amount of blood in the body. The total amount of blood in normal adult is equivalent to 7 to 8% of body weight, or 70 or to 80 milliliters of blood per kilogram of body weight. Blood volume can be divided into two parts: circulatory blood volume and stored blood volume. Circulating blood volume refers to the rapid circulating blood flow in the circulatory system. Stored blood volume is the amount of blood in the liver, lung, abdomen, vein, and subcutaneous venous plexus, and the two are in the dynamic balance. In the case of exercise and massive blood loss, the stored blood volume can be mobilized and released to make up for the lack of circulating blood volume. Under normal conditions, the blood volume in the body remains relatively constant, which is a necessary condition for maintaining normal blood pressure and the normal blood supply of various tissues and organs. When the body loss of blood leads to insufficient circulating blood volume, it will make tissues and organs appear symptoms of ischemia and hypoxia. Clinically, blood loss is divided into three levels: small blood loss, medium blood loss, and large blood loss. Small blood loss is less than 10% of normal blood volume, about 500 milliliters or less. By strengthening the heart and narrowing the blood vessels, the degree of blood filling in the blood vessels will not change obviously. At the same time, part of the stored blood will be released to replenish the circulating blood volume, so the body will not appear obvious symptoms. Blood loss of 20% of normal blood volume is considered moderate. Compensation is not sufficient to maintain normal blood pressure, and serious symptoms may occur, such as blood pressure drop, rapid pulse, thirst, disease, and nausea. Loss of more than 30% is massive and can be life-threatening. Therefore, patients with acute massive blood loss should be treated with transfusion and fluid infusion. A safe transfusion ensures that the erythrocytes are not agglutinated by the agglutinating in the plasma of the recipient. Plasma does not agglutinate the erythrocytes of the recipient. Therefore, blood group must be identified before transfusion to ensure that the donor and the recipient have the same blood group. Cross-matching test must be done before transfusion. Cross-matching is to mix the erythrocytes of the donor with the serum of the recipient on the main side, and the mixture of the erythrocytes of the recipient and the serum of the donor is the second side. The main side checks whether the erythrocyte transfusion is agglutinated by antibody of the recipient. The secondary side checks the antibodies transfused plasma that led to the recipient's erythrocytes. Cross-matching tests can be used to test for errors in blood group identification and to identify other different blood groups other than the ABO blood groups. In the cross-matching test, if the main site and the secondary site do not agglutinate, it is matching, can be transfusion. If the main site agglutinates and the blood confusion is prohibited, the main site do not agglutinate, the secondary site agglutinate. Set the basic matching blood. Transfusion should be careful. Transfusion of type O donors to other blood types or other blood types to AB recipient is basically matching blood. Although there is no agglutination on the main site, indicating that the transfusion lymphocytes are not agglutinated by the serum antibody of the recipient. But agglutination on the secondary site can destroy the lymphocytes of the recipient. Therefore, in the absence of the same blood source of emergency, can be transfusion a small amount of basic matching blood. But it should be noted that the amount of the basic matching blood transfusion is less than 200 milliliter. Serum antibody titer should be not too high. Transfusion speed should not be too fast. The third principle of transfusion is blood component therapy. Blood component therapy refers to the preparation of the various components of human blood, such as red blood cells, white blood cells, platelets, and plasma, into high purified products respectively, and then transfuse them to patients with different needs. Therefore, component transfusion can enhance the pertinence of the treatment, improves the curative effective, reduce the adverse reactions, and save the blood source. The fourth principle is autotransfusion. Autotransfusion is a type of transfusion therapy that's the patient's own blood to meet the needs of the patient during surgery or in an emergency. Autologous blood transfusion can not only avoid the adverse reactions and complications of the different blood transfusion, but also expands blood source. To summarize the content of this section, constant blood volume is necessary to maintain normal blood supply to tissues and organs. When the blood loss reaches a certain level, blood transfusion is needed to save life of the patient. The basic principle of the transfusion is to ensure that the red blood cells of the donor are not agglutinated by the antibody in the plasma of the recipient. That's all for today. Thank you. Goodbye.